Hi, I'm Dr. B. I'm a medical doctor and I like to make medical education videos. Today's question is, what is postpartum psychosis? What's it look like, and is it treatable? Remember in Texas in 2001, a Texas mom drowned her 5 children in her bathtub? And in 2004, another mom named Dina Schlosser cut off her own daughter's arms. And in 2014, Carol Coronado stabbed each of her 3 daughters, once in the throat and once in the heart, a 1-year-old, a 2-year-old, and a 3-month-old. Now, are these women monsters? Or do they have something going on, and are they victims or even mentally ill? To understand postpartum psychosis, let's explore the normal body changes following the birth of a child. Immediately following birth, there is a sharp drop in the normal blood hormonal levels in a new mom. Estrogen levels, progesterone levels, cortisol levels all drop significantly, and the mother experiences a withdrawal effect within about 48 hours. This, in combination with changes of lifestyle, new sleep deprivation, pain post-birth, and changing dynamics at home and relational changes with significant others and spouses, leads to profound changes at home. One of these changes can be a real alteration in the mother's mood. Now, a mood change that the mom experiences can be divided into 3 categories: the postpartum blues, or also known as baby blues, postpartum depression, or postpartum psychosis. Now, irritability, anxiety, fluctuating mood, and emotional reactivity are very common in up to 85% of new moms. These symptoms tend to be mild. They spontaneously go away within 2 to 4 weeks. This commonly causes mood alterations and is known as the baby blues. Now, the baby blues happen immediately or within a few days, and again, the symptoms are temporary and very common. Now, more severe is what is known as postpartum depression. Instead of 85%, only about 13% of moms experience this. And this is really an issue of degree. It's like baby blues, but more severe. It lasts longer, it causes more daily dysfunction, and an inability to do daily activities. It looks really the same as major depression. It can look like excessive guilt, anxiety, anhedonia, which is loss of pleasure in doing almost any and every activity. It can be depressed mood, trouble sleeping, and fatigue. It's more severe and it's prolonged compared to baby blues and will last longer than 4 weeks. And this is really considered a disorder. Now, the drop in hormone levels result in a decrease in neurotransmitters, notably serotonin and dopamine. So just like major depression, postpartum depression is usually treated like depression and includes talk therapy and medications in particular that can increase serotonin. Because keep in mind, common antidepressants increase serotonin, so it makes good sense. It can really be thought of as a major depression in the postpartum period. Now, next in severity and most terrifying is postpartum psychosis. This is different from baby blues and depression. It is much less common at about 1 out of 1 to 2,000 births. However, given the large number of children born each other, there can be many cases. Keep in mind, only the most egregious and horrifying make the national news. It is vital to understand, though, because of the remarkable risks to both the mother and her child. Postpartum psychosis is not feeling down, sad, or unable to do activities. It instead is a departure from reality, and that's the definition of psychosis. Postpartum psychosis can occur within hours to days following birth, and usually has a very rapid onset of psychotic symptoms. And these include hallucinations and bizarre delusions with disorganized behavior. Remember, delusions are a firmly held belief despite all logic or evidence to the contrary. And hallucinations are seeing or hearing things that are not there and that no one else experiences. In postpartum psychosis, most commonly the hallucinations are auditory, that is hearing things, and visual, seeing things that aren't there. Much rarer do these hallucinations involve taste or smell. Now, women with postpartum psychosis are also intermittently often manic. They'll go for days without sleeping. This is combined with the normal sleep deprivation of having a new infant. And they can also have delusions of grandeur. But most importantly, the delusions in postpartum psychosis and the hallucinations that occur center around their child. This is vitally important because in routine delusions like you see described described in schizophrenia. Someone who's psychotic will be paranoid that the CIA or the army is spying on them or communicating with them through an implant in their brain. This is common, but women with postpartum psychosis are different. Their delusions are different and centered on the baby. For example, a new mother may believe that her baby is the spawn of Satan. Likewise, when they have hallucinations, these are centered on the baby. The auditory hallucinations may be voices talking to them, but they tell them to kill the child. Or the voices might tell the new mother to throw the baby off the roof or to drown the baby. And frequently, these delusions and hallucinations have a very strong religious undertone. Both Andrea Yates and Dina Schlosser are classic examples. After Andrea Yates methodically drowned her 5 children in the bathtub, she told investigators that she did it because she was such a bad mother, she had doomed her young to eternal damnation. She believed that she had the sign of the devil, 666, burned on her scalp, and killing her children was really an act of mercy to save them from going to hell. She believed in their innocence, they'd go to heaven, and the only way to save them, she said, was to kill them. Another mother, Dina Schlosser, saw a news story about a lion mauling a young boy. She took this as a sign of the impending apocalypse from God. She said God then commanded her to cut off her daughter Margaret's arms, and then her own in a tribute to God. Now these two women demonstrate very typical postpartum psychotic delusions and hallucinations, and these psychotic symptoms are a risk to both mom and baby. Of the women who develop postpartum psychosis, research suggests that there is approximately a 5% suicide rate, as well as a 4% infanticide rate associated with the illness. So why do new moms get psychosis? Well, there is strong accumulating data that supports a very strong relationship between bipolar disorder and postpartum psychosis, with other more minor contribution from things like sleep deprivation, poor social support, and difficult partner relationships. In one large study, 64% of women who had an acute episode of postpartum psychosis developed episodes of recurrent bipolar illness, and only 36% of those women did not have another episode of bipolar. A second, more recent, large study looked at 106 women with postpartum psychosis, and these women had their medication discontinued, and about a third of these women had another episode of bipolar disease in the next 2 years. So there is a strong relationship between bipolar disorder, and it is common that the postpartum psychosis event is really the initial presenting episode for an individual with underlying bipolar disease that has never been diagnosed. So what is the treatment for postpartum psychosis? Well, baby blues and postpartum depression are not usually emergencies, and they are usually managed as an outpatient with office therapy, outpatient medication regimens. Postpartum psychosis is markedly different because of the 5% suicide rate for the mom and the 4% risk for death of an infant. It requires psychiatric hospitalization and emergency care, with inpatient treatment to protect both mom and the baby. Now, once stabilized as an inpatient, often atypical antipsychotics are prescribed because women who want to breastfeed, who are told they can't breastfeed if they take the antipsychotics, very commonly won't take their medications. After using antipsychotics for initial stabilization, more long-term lithium is used, and possibly even electroconvulsive therapy or ECT can be utilized. That's postpartum psychosis. That's what it looks like and the treatment. Thanks for watching. If you enjoyed this video, please click on these videos on psychosis and this one on schizophrenia. And please don't forget to hit subscribe.